Hi everybody. So today I'm going to talk about the heart and its structure, how it works, and a few key concepts and its function. I'll also mention how my condition, supraventricular tachycardia, SVT, fits into the heart's electrical system and how things can go wrong. So to start off, the heart is a muscular organ located in the mediastinum. That's slightly left of the midline of the chest. It's about the size of a fist, and it's divided into 4 chambers: the right and left atria, which receives blood, and the right and left ventricles, which pump it out. The heart is encased in a pericardium, and it's made up of 3 layers: the epicardium, the myocardium, which is the muscle layer, and the endocardium, which is the lining of the heart's interior. So, the right atrium receives oxygen poor blood from the body via the super and inferior vena cava, while the left atrium receives oxygenated blood from the lungs through the pulmonary veins. And what's funny is that our hearts, before birth, they work a little differently. So before birth, a baby's heart operates differently to bypass the non-functioning lungs. The foramen ovale is a hole between the right and left atria, and the ductus arteriosus connects the pulmonary artery to the aorta. Once the baby takes its first breath, these structures close, turning it into fossa ovalis and the ligamentum arteriosum, respectively. If they fail to close properly, conditions like patent foramen ovale, or PFO, or patent ductus arteriosus, or PDA, can develop. So basically, the heart's muscle, the myocardium, is made up of striated muscle fibers connected by intercalated discs. I wanted to be fancy, so I used a fancy word. Allowing for synchronized contraction. The heart's rhythm is controlled by an intrinsic conduction system. This starts at the sinoatrial or SA node, which is kind of like the pacemaker of your heart. It passes through the atrioventricular, or the AV node, and travels down the bundle of His. No, I did not misspeak, even though I do that a lot. The bundle of His is kind of like a collection of cells that are conductant to electricity, or electrically conductant. So these travel through the right and left bundle branches and into the Purkinje fibers, and this helps coordinate heartbeats. So in my case, SVT is caused by an extra pathway to the heart's electrical system, and it disrupts the normal conduction, leading to rapid heart rates. So this condition isn't life-threatening, but it can cause palpitation and discomforts, and to be quite honest with you, it's very extreme. So my heart rate has reached up to 200 beats per minute, and that's not good, because when your heart is beating that fast, it's not resting, so it's not filling up with blood, so it's not doing anything. So to fix it, I have to basically shock my heart, and I can do this by, the only way that works for me is by jumping in a cold shower and submerging my face in the water for as long as possible, basically drowning myself until I feel a big thump, and then it evens out the heart rate again, and then I sleep for like 7 hours straight. Last time I think I slept for 12 actually, and it's never a guarantee of when it's gonna happen. So, okay, enough about that. The next thing we'll talk about is the cardiac cycle. This includes distal, and when the heart relaxes, which is what I was talking about doesn't happen during my SVT attacks, and the systole, which is when the heart contracts and pumps blood. So cardiac output, or CO, is the amount of blood pumped per minute, and it's calculated as stroke volume times heart rate. Blood pressure is regulated through factors like preload, afterload, and contractility. Okay, so chronotropic agents influence heart rate. Positive ones, like epinephrine, speed it up, while negative ones, such as acetylcholine, I can't say that word, sorry, slow it down. Similarly, the intratropic agents affect the strength of contraction. Positive entropes, like digitalis, increase contraction strength, and negative interlopes, they decrease it. Inotropes. I'm sorry. I'm trying to do this without... Yes, inotropes. I'm sorry. Okay, so now let's talk about a number of diseases that can affect the heart's function. So coronary artery disease, or CAD, is caused by arthrosclerosis, sclerosis, I'm so sorry, which narrow the coronary arteries, reducing blood flow and leading to myocardial infarction or a heart attack. Yes. Okay, another one is actually congestive heart failure, which is different. It occurs when the heart can't pump blood effectively, and congenital defects such as ventricular septal defect, or VSD, and trilogy of Fallot, which can also cause significant structural and functional issues. Okay, sorry. Trilogy of Fallot. Okay, that's what I'm going to say. Fallot. I'm going to say it like that. Okay, so in conclusion, the heart is a complex organ that relies on precise electrical and mechanical coordination to function, from delivering oxygenated blood to tissues through the aorta to receiving oxygen-poor blood from the body through the vena cava. The heart keeps blood flowing through the body's vast network of vessels. Disorders like SVT, CAD, and CHF can disrupt this balance, highlighting the importance of cardiovascular health and the need for proper medical care. Actually, something else that I wanted to mention that I thought went along well with this chapter, if any of you watch anime, this is right up your alley, but there's this anime, which is a Japanese cartoon, called Cells at Work, and they look like humans, but the story follows this one little red blood cell. She's painted as like a girl with red hair, and it's really cool. I think you should check it out. It really goes well with the cardiovascular system. Anyway, thank you for listening.